Hello YouTube, welcome to my channel, Dr. Vibes, a learning point, and please do subscribe the channel if you find the videos useful. In this video, we will study about schizophrenia. Okay, so what is schizophrenia? It is a psychotic disorder or a group of psychological disorders in which you see abnormality in language, perception, cognition, and behavior. Other definition says that it is a chronic illness in which there is profound functional impairment. Next, we come to the etiopathogenesis, that is what is the causes and how it leads to schizophrenia. So if there is a positive family history of schizophrenia in the family, that is multigenic inheritance. I've written it over here, multigenic inheritance. If there are some adverse events that is going in the family, there is alcohol, cannabis and drug abuse, where cannabis abuse is really important. Then you have hypoxia or infection to the fetus, and you have stress or malnutrition to the mother. So all these causes will lead to increased dopaminergic activity in the mesolimbic pathway. This will lead to increased serotonin activity and decreased dendritic branching. Other pathogenesis can be there is increase in the ventricular size and there is cerebral atrophy. Okay. Third, there is temporal lobe epilepsy and Huntington's disease. Now come to the epidemiology. Males are usually more affected than females in schizophrenia. Usually adults of age 20 to 40 years are seen, and there is a history of schizophrenia in the family usually present. Coming to the clinical features, you have positive symptoms, negative symptoms, and you have some cognitive symptoms. In positive symptoms, you have hallucinations, you have delusions, you have thought broadcasting, thought insertion, and thought withdrawal. People also say that there is disorganized speech and increased talkativeness under positive symptoms. What are negative symptoms? This is really very important. That is evolution, abulia, anhedonia, alogia, and apathy. Let me explain the terms for you. Evolution, that means there is decreased desire to work. Now V के पास W आता है, इसीलिए evolution होगा तो work से related होगा. Abulia, I think you all have heard about the song Bullea. So Bullea is a very energetic song. So abulia means energy will be decreased. Anhedonia, that means there is loss of interest in the previously interesting activities. And alogia means that there is absence of speech. Now we move on to the cognitive symptoms. Under cognitive symptoms, you have decreased attention, concentration, executive dysfunction, social cognition, and there is decreased working memory. Now come to the classification of schizophrenia. It can be catatonic, undifferentiated, paranoid, disorganized, and residual. What do you mean by paranoid? See, for P, that means paranoid has better prognosis. And here the onset is 30 to 40 years. Most important feature is you see auditory hallucinations, and under delusion you will see persecution and reference. Delusion of reference मतलब कोई हमारे बारे में बात कर रहा है, नहीं कर रहा है, लेकिन मेरे को लग रहा है कि वो मेरे बारे में रेफरेंस देके ही बात कर रहा है, ठीक है. And delusion of persecution means somebody is going to kill me. I had that delusion. Disorganized, that means there is loosening of association and there is neologism. Neologism मतलब new ideas आएंगे. Catatonia, this is a very important mnemonic. Mesk cap. Mesk cap में क्या है? M is for mutism, मतलब catatonic schizophrenic individuals mute रहेंगे, चुपचाप रहेंगे. E for echo. इको से क्या रिलेटेड है? that जो schizophrenic individual होंगे वो एग्जामिनर के वर्ड्स को रिपीट करेंगे. इको में जैसे रिपीटेशन होता है. S is for stupor. पर्सन अवेक होगा लेकिन इमोबाइल होगा. C for catalepsy. That means abnormal posture against gravity. Gap. GAP. Now A is autonomic obedience. मतलब मैं जो भी पर्सन को करने बोलूँगी वो easily उस चीज को करेगा and that will help and he will help me doing that work. Autonomic obedience. G is just opposite of autonomic obedience. इसमें person resist करता है in what you are doing. Now residual means there will be previous history of low positive and negative symptoms. And बचता है undifferentiated. इन चारों को छोड़ के जो भी features आएगा that will be undifferentiated schizophrenia. Now come to the diagnosis. So basically you have to rule out other medical conditions which can cause these symptoms. You have to check if there is any history of drug abuse, medications which can lead to the symptoms. Also you can do thyroid and adrenal function test and you will do CT MRI. Now one very important diagnosis of schizophrenia. I'll share it with you now. So basically, if these are the 5 active symptoms of schizophrenia, that is delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, and negative symptoms. So if any of these 2 symptoms are present and any one of these first 3 symptoms, then that is diagnosis of schizophrenia. Now, ये तो हुआ symptoms कौन से होना चाहिए. What should be the duration? It should be more than equal to 1 month, and there should be a history of past 6 months. And this presence of the symptoms and duration will give me the diagnosis of schizophrenia. Now there are 2 more terms, brief psychotic disorders and schizophreniform disorder. Brief psychotic disorder means that there is more than one positive symptom but lasting less than 1 month. And schizophrenia मतलब active symptoms है more than 2 but 1 to 6 months. So let me just simplify this for you. Schizophrenia में more than 2 of these symptoms, duration 1 महीने से ज़्यादा और 6 months का हिस्ट्री होना चाहिए. ब्रीफ साइकोटिक डिसऑर्डर मतलब 1 symptom present और 1 month से लेस का हिस्ट्री. Schizophreniform disorder 2 symptoms present लेकिन 1 to 6 months का हिस्ट्री. Okay, now how will you treat the schizophrenic individuals? Usually we have a medical diagnosis in which you have antipsychotics, anti-epileptics, anxiolytics. In antipsychotics you have typical and atypical. Typical may you have chlorpromazine and atypical may you have risperidone. Now this is the first line treatment of schizophrenia. याद होना चाहिए. Atypical antipsychotic, that is risperidone. You have anti-epileptics like clozapine and olanzapine. And you have anxiolytics as well. This is the medical treatment. You can also go for psychotherapy, which includes cognitive behavioral therapy. And then you should give the person a friendly and regular environment. And in case of acute attack of schizophrenia, hospitalization may be required. Coming to prognosis, just remember that the best prognosis is of catatonia and the worst prognosis is of simple schizophrenia. और most common schizophrenia जो दिखाई देता है वो undifferentiated schizophrenia होता है. Then you have the complications. Mostly people will suicide in case of schizophrenia. Others can be OCDs and alcohol, drug abuse. So this is all about schizophrenia, starting from the definition, etiopathogenesis, epidemiology, clinical features, how you are going to diagnose it, management, prognosis and complications.